In this morning's Health Watch, Alzheimer's, a national crisis. We begin our three-part series with an exclusive look at a groundbreaking report the Alzheimer's Association is presenting on Capitol Hill this morning. The details are staggering. The report predicts the number of Americans with Alzheimer's will increase from more than 5 million today to more than 13 million in the year 2050. The cost of care will soar from $172 billion to $1 trillion. And joining us to discuss what can be done is Robert Egge. He is the Vice President of Public Policy at the Alzheimer's Association. Good morning.
Good morning.
These numbers are already horrible. How do we account for the fact that they're just going to continue to explode?
Well, the key message of this report is that we are on a track right now where Alzheimer's will be the defining disease of the baby boom generation. And that's happening for several reasons. One is rooted in the nature of this disease. It's a disease where the biggest risk factor is aging. And so if you're over 65, you have a 1 in 8 chance of having Alzheimer's.
Right.
But if you're over 85, you have almost a 1 in 2 chance.
I need you to repeat that again. So what's your chance of Alzheimer's at over 65?
When you're over 65, your chance is 1 in 8.
Right. And over 85?
Almost 1 in 2.
50%.
That's right.
So as you get older, the odds really tilt in the directions of Alzheimer's.
That's right. And the other thing that's going on is that we have an aging society. The baby boom generation has been moving along. It's just now entering retirement. So we know where this is going.
Yeah.
Also, there's a good news story in other diseases that we're having progress against things, so we're living longer.
Right.
But we're aging into the highest risk years for Alzheimer's.
Phenomenal. And as just been reported, there are really no preventions or cures.
There are not. And that's unusual for a disease of this magnitude, that right now we're standing with no good therapeutic options to change the course of this disease.
The importance of the report today, as you go to Capitol Hill, what is your most important recommendation?
Our most important recommendation right now is that we need a national strategy. Right now, this is probably the largest national crisis that our nation isn't routinely talking about. So we need to have a conversation. We need to have it in our homes, in our doctor's offices, but we need it on Capitol Hill. We need it in the White House to figure out what are we going to do about this crisis we're heading towards. And
I want to go back to a number again. If left unchecked, what kind of a price tag are we talking about for the country on an annual basis? On
an annual basis, it will be as large, without taking into account inflation, it'll be as large as $1 trillion a year. If you add it up, that's $20 trillion between now and 2050. That's enough to pay off the entire U.S. debt and then still have enough money left over to send a check for $20,000 to every man, woman, and child in America. It's staggering.
Okay, so a national strategy has to be developed. Do you think part of the answer has to be in pharmaceutical companies, in research and development, in hospitals? Is that where the money needs to go?
We need a comprehensive solution. That's absolutely right. And right now, fundamentally, what we need to do is invest more in research. We show in this report that if we had therapies that we have in other diseases, for instance, something like Lipitor that helps in heart disease and prevents onset, that we would cut these numbers almost in half.
Wow.
If we could just delay by 5 years.
If you could just delay it by 5 years.
That's right.
That's right.
That's right.
Because what's out there now really just helps symptomatically, but doesn't retard or stop or delay the disease per se, right?
That's right. And we're glad those therapies are out there, but they don't change the course of this disease.
All right.
There's no way to reverse it.
Robert Egge, we do appreciate your time.
A lot happens early on The Early Show, weekday mornings on CBS.